Good afternoon and welcome to Can Cable 21 TV. Today, we are talking to you about many wonderful information, great information, and unbelievable therapies that are happening today. But before we start that, my name is Lucy Aquino. I am the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center. And with me today, we have Dr. Chadwick Podromos. Dr. Podromos, thank you for being on the show today.
Thank you for having me.
That's wonderful. And Dr. Podromos is a board-certified orthopedic surgeon. He's an assistant professor with Rush Medical College, Department of Orthopedic Surgery. He's also the president of the Illinois Sports Medicine and Orthopedic Centers and affiliated with Advocate Illinois Masonic Medical Center and other hospitals. Dr. Podromos specializes in knee and shoulder problems along with general sports medicine, and he focuses his practice on techniques that help restore joint function and delay or prevent the need for joint replacement. Wow, that is huge. You're all over the place, Dr. Podromos. I know we were having this discussion prior to coming here. But I really want to thank you for being on the show today, because today's topic is so important that for me, when I heard all the wonderful things that you are doing in your practice and with your patients, it was incredible. And I couldn't wait to get you on the show to discuss this with our viewers. I think everyone needs to know what it is that you're working on and what you've been working on. So Dr. Podromos, one of the things that we're talking today, obviously, is about stem cell therapy. And regenerative medicine has been developed with a huge interest in orthopedics, especially when you look back in 1992 when some of these were great hopes of happening and moving forward. But here we are today with alternative therapies for cartilage damage, arthritis, bone defects, and so much more. And that's why we're here today. I want to talk about what it is that you're doing with your patients and your practice. So, Dr. Podromos, and how and what is plasma and stem cell technology? What exactly is that?
Well, they're part of a general philosophy, and you mentioned the variety of things that we're involved with. I should say that there's a unifying philosophy that my goal, and increasingly the goal of many others, is to tap the body's own healing potential. So we endeavor to get people better using stem cells and platelet-rich plasma without using drugs. The thought is that your body can heal itself best, and my job as a physician is to help the body heal itself without, in some cases, polluting your body with drugs that purport to help but don't do as well as your body. So, as to your specific question, platelet-rich plasma is a treatment technique that's based on the finding, 20, 30 years ago, that platelets, which we have always been aware participate in blood clotting, actually contain growth factors that help you heal, and substances called cytokines that are kind of like hormones that mediate inflammation. So they can be anti-inflammatory and help you heal. Stem cells, are part of a much larger topic. Stem cells can be used to grow new tissue in the heart or the retina or the brain. Their application in orthopedics, though, is what we call immunomodulatory, and basically they're used kind of like platelets because they also have growth factors and cytokines, many more than platelets. And the idea is that these help your joints, your muscles, your tendons heal, and that they quiet inflammation naturally.
So really today, what we're going to focus on is our platelet-rich plasma. And I understand that you use that in your practice. Can you walk us through an example of what you would use platelet-rich plasma for?
Right. So what the technique consists of is a blood draw in the office, about 40 cc's of blood, not much, a little more than what you get in your doctor's office if they were drawing some blood for blood tests. And then the blood is processed in our office. It's centrifuged, the red cells are removed, the platelets are concentrated, they're activated. And the net effect is that 40 cc's of blood are reduced to 4 cc's of plasma, with the platelet count roughly quintupled. So we started using this technique in December of 2010. I have a 501c3 nonprofit foundation that does clinical research, and we started this as a prospective study through our foundation. And we built on the background research for this, which was largely done in Europe and in Asia, and read a variety of papers that had been written in the early 2000s and even the 90s, where people tried various different concentrations of platelets and found that concentrating them roughly 3 to 5 times produced the greatest efficacy. This general technique got a lot of publicity when Kobe Bryant, the famous basketball player, went to Germany to have a technique that's similar to this done on him. So one comes into the office, we draw your blood, 35-40 minutes of processing and activating it, and then we inject it into the affected area, which in our practice is most commonly the knee, second most commonly the shoulder, then the hip, foot and ankle, other joints as well, and also in tendons, for example, the rotator cuff tendons. So we inject this with ultrasound guidance. It's a shot, so you feel it, but it's not particularly painful. And then you go home. We use a little Novocaine. Sometimes we don't even use that. There are no sedatives, nothing. You can drive yourself home. And then the effects can start as soon as the next day, more commonly 3 or 4 days, and they can take as long as a month. So after a month, we kind of know where we stand.
So obviously, these are being done in the office. Patients are going home the same day. So these treatments are safe.
Yes. So nothing in life is 100% safe. However, and we tell all our patients that there is a theoretical risk of infection anytime you stick a needle in somebody. But we have now done over 2,000 of these as part of our prospective study, and we have had no infections, no adverse events of any kind. And not just with us. This has been widely reported elsewhere, and this has been found to be very safe elsewhere as well.
Now, is this also FDA approved?
Yes. Everything that we do with PRP and stem cells, we do in strict accordance with FDA guidelines. I participated in an FDA workshop on stem cells last September, and they have, again, very specific guidelines, and we make sure that everything is consistent with what they approve.
So if, let's say, for example, I'm a patient, and I believe maybe I've torn a rotator cuff or maybe hurt my rotator cuff, and I come and see you as an orthopedic surgeon who specializes in, and I know that patients are crazy about going to you because everyone I know that goes to you, it's just, this guy is fantastic. But now I go to you, and you probably, if you recommend the platelet plasmas that we should do this type of therapy, how many treatments does it usually take for something like that?
It's in our hands 1 or 2. There are many practitioners who recommend doing 3 and then seeing what happens. But as I was reading our literature, scientific literature, I couldn't see any reason to do that. And it doesn't work in everybody. It does in most people. Maybe 3/4 of the people overall, depending on what the problem is. And I just didn't want to be doing 3 treatments if it wasn't going to work. So we do 1, and then we wait a month. And at that time, if it's ineffective, we don't do any more. If you're completely fine, which many people are, we don't do any more. If you're partially improved, usually we'll do a second. Rarely, hardly ever a third. And I'd like to add too that it isn't the first thing that I offer people when they come in. We have many people that come in with chronic problems they've had for a very long time, and they've tried everything else, and so we go right to this. But really, I believe strongly in what we call activity modification. So people have sore joints. We try to get them on exercise programs that are beneficial. We try to work with them in their activities of daily living, and our physical therapists do, to have them stopping things that bother them, and you treat them like that. And then if they're not getting better, we'll progress to PRP, or in some cases stem cell injections.
And doctor, I know that that some of these new technologies that are happening and techniques, especially in health, is this something that's covered by insurance?
No. The visits where people see me are covered by insurance, but the stem cell preparation itself or the PRP is not. Actually, so none of the carriers cover it. Medicare doesn't cover it. Interestingly, I treat work-injured patients fairly often, and we have found that the workers' comp carriers who are less constrained by kind of large bureaucracies that have centralized policymaking, many of the workers' comp carriers are paying for it because they recognize, because many of the patients, maybe even most, but many of the patients are being treated with this as an alternative to surgery, and it's obviously nicer for the patient, but it's also less costly for the carrier.
So this is obviously, is this something that's affordable for someone who doesn't have insurance or the insurance won't cover it? Something that's affordable?
Yes, it is, and you know we have people with insurance, we have people on public aid, we have people with no insurance who have heard about it, and it's it's in the hundreds of dollars for the PRP, it's a few $1,000s for the stem cells, and it sounds like a lot of money, although I've been careful. I really, when I started doing this, I wanted this to be something that was available to the many, not just the few. So I purposely priced it substantially less than the average price for those treatments, both in our state and in the country.
Well, obviously, there are a lot of things that even insurance in general sometimes don't cover anyway. And if this is something that we have to pay for, because I would rather try something like this as an option to surgery.
Right, and that's what patients say, and I get people referred to me from all over, and the first thing that many of them say is, wow, I didn't know that this alternative existed. In successfully treated patients, they're usually thrilled that that they've been able to avoid surgery and are able to function well.
One of the things that I was very interested in when I went and learned a little bit more about your practice, and more in particular about you, I love how you take care of your patients, for one, and two, I really appreciate seeing that you really wean patients off of pain medications. Can we talk a little bit about that?
Sure. Right. Yeah, I feel very strongly, and I've been practicing for 31 years, so old school guy maybe, but pharmaceuticals have done many wonderful things. Probably the biggest contribution has been in antibiotics for infectious disease, that sort of thing. But the proliferation of symptom mitigating medicines, things that are just there to kill pain, makes people worse, in my opinion, more often than it makes them better. Because what happens is this. And I want to emphasize that everybody means well who uses these drugs. The pharmaceutical companies are trying to help people. Doctors are trying to help people. So this is all well-intentioned. But here's what happens. There's a class of drugs called non-steroidal anti-inflammatory drugs. There are 3 that are over-the-counter. One is ibuprofen, which is sold as Motrin and Advil. There's naproxen, which is sold as Aleve. And then there's aspirin. There are many, many prescription counterparts to these. 2 of the most popular are meloxicam and diclofenac or Voltaren. So these drugs are marketed as decreasing inflammation. And they do, but the thing is, we heal by something called the inflammatory cascade. So when you decrease inflammation, you are interfering with healing. And now, many things will heal anyway, but in surgery, for example, there are many. I do reparative surgery, repair rotator cuffs and repair ACLs and so forth and so on. And these drugs have been associated with decreased healing, both surgically and non-surgically. So it's a little deceptive to think, not intentionally deceptive, but it can be sort of misapprehended that, well, they're anti-inflammatory, that's good, but the fact that they're kind of anti-healing drugs, kind of like cortisone, not so good. So these are great drugs to take if you have a fever for a day or two or a headache or something, but chronically they're not. In addition to that problem with them, probably the generic problem of all drugs is that they mask symptoms, that they mask pain, and you would think that's good, but the pain is there for a reason. I tell my patients the pain is your friend because the pain lets you know that something is wrong. For example, if you injure your knee or your ankle and then you take a pain pill and you go about your daily routine and go to work and do physical things, what that allows you to do is to damage yourself worse than you would have had you not taken it.
Right.
And the patients that I see in my office when I examine them, there are some patients I'll examine their knee and I'll just touch them and they'll, jump a foot off the table because they're so tender.
Right.
And those patients invariably are patients that have been treated with pain pills.
Right.
And if you don't take, there are some times when you need them, of course, but if you try to avoid them, it kind of forces you to modulate your activities,
Right.
and then your body heals itself.
Right.
The third parameter with these pills is they have a high incidence of side effects. The New England Journal of Medicine, which is the #1 medical journal kind of by consensus in the world, wrote a paper, 12 years ago maybe, where they estimated that there were more than 15,000 deaths every year in the United States from the side effects of these drugs. Mostly bleeding ulcers, which can be fatal,
Right.
kidney failure, liver failure. So even beyond those,
Right.
the real thing that you want to do is get yourself better by getting your body to stop doing the things that aggravate it, to taking the precautions you need to make yourself heal, because most things heal on their own. I don't use platelet-rich plasma or stem cells in most of my patients, and most of them I just kind of shepherd them through letting their body heal itself.
Right.
But I have found that pain pills of all kinds, we use them after surgery. Even after surgery, we rely most heavily on ice machines, which patients say work better than narcotics. So I'm not nutty about this, I don't think. We're just, never using
Common
them.
sense.
But really, and the proliferation of pharmaceutical drugs now is staggering
Right.
compared to what it was 10 or 20 years ago. And in many cases, it's counterproductive.
Right. I do want to remind our viewers that our lines are open. The number is at the bottom of your screen, and you can call 312 area code 738-1060. If you have any questions for myself or Dr. Podromos, please give us a call. The lines are open. So, Dr. Podromos, we know that this is, what you're doing with your patients and weaning them off of painkillers and all of that, I think that the body naturally takes care of itself. It's something that most people or most physicians don't talk about. And this is great to see that this is something that you're constantly reminding our patients about. Because a lot of times we all think, oh, we need a painkiller.
You're right, and it's an integral part of what I do. Another aspect of this is nutritional supplements.
Right.
So I've spent a great deal of time reading what we call the scientific literature to see, because you see these things advertised all the time, and are they real, are they fake? And so we actually maintain a website where I've researched. I found 10 nutritional supplements that help joint problems based on what we call peer-reviewed articles indexed in PubMed in our scientific literature that showed efficacy to statistical significance when tested against placebo. And in fact, one of them, glucosamine and chondroitin, which sometimes gets bad things written about it in the lay press, and I don't know why, because there's abundant scientific literature that shows that it's the only substance out there that's been shown to actually slow the progression of arthritis in some people. These things are much safer than pharmaceuticals, and we tell people which of those that we think may be helpful if they want to try them, and they're very safe.
Okay. So who's a candidate for a treatment such as this?
So basically, let me start by saying who isn't.
Okay.
So the only, as we say, contraindications are people with active infections, because it could be spread, people with active cancer. So a history of cancer is fine, but if you have an active tumor at present, and ladies that are pregnant. Outside of that, basically anybody is, and in fact, I treat young, healthy athletes, but I treat people that are very old and very ill, people who are on Coumadin blood thinners, people who are very heavy, and people who are bad surgical candidates and can't have surgery. So we can treat people at that spectrum. Most of our patients, though, are people in between. I'll get sort of aging athletes, people in their 40s whose joints are starting to wear out. I'll get people in their 50s, 60s who have been told they need a knee replacement. Treating sports injuries. I'd say one interesting area, so for arthritis, for starters. And we have overall, taking all comers, out to 2 years, about an 80% success rate with people who come to us who are joint replacement candidates being treated with PRP or stem cells and not needing a joint replacement. Now we have longer term data, it's just, it's taking us time, we're working on it right now to figure out exactly what the longer term data is. It's stratified a little by how bad the problem is. If you've got a diminished joint space, but some joint space remaining, our success rate is in the range that I just said. If it's bone on bone, it goes down to about 50-50, but there's really nothing else that helps people like that besides surgery. As far as sports injuries, though, so let's say one thing that's been very interesting to me is people with rotator cuff problems.
Right.
So I'm a knee and shoulder arthroscopic surgeon by trade, and when people tear their rotator cuff completely, I'm very actively involved in fixing it and trying to apply advanced techniques to it, that sort of thing. However, if the rotator cuff is only partially torn, we have found that our success rate is well over 90% using PRP injections, not even stem cell injections, to getting people better to where they don't need surgery. We're now getting some MRIs afterwards, and a friend of mine who's the chairman at Tulane did a study like this where we're documenting that the tendons are actually healing. So I see a lot of people for second opinions who have torn rotator cuffs but not completely torn. So the idea is if it's completely torn, the rotator cuff is kind of here. If it completely tears and it's discontinuous, these treatments aren't going to help reattach it. But these tendons tend to tear from the undersurface, so they kind of delaminate underneath. And if there's a layer remaining to serve as a scaffold, we found that PRP injections can help these heal. We do physical therapy as well to where they don't need surgery. And we take care of other tendon problems, Achilles tendonitis, patellar tendonitis as well.
So wow. So it's a huge gamut of all of these. Now, is there an age restriction on this type of, for a patient for this type of treatment?
No. We did I treated a 99-year-old lady who came down from Michigan not long ago, actually, because it's very safe.
All right. Now, one of the things I found interesting, and I know our time is flying by here really, really quick, which means I got to have you come back, because there's just so much more I want to talk to you about.
Lucy,
but I understand that PRP can also be used to enhance the appearance of skin as well.
Yeah, it's very interesting. So this was kind of publicized as the, some Hollywood people, but basically what you can do, so the PRP just helps tissue be healthier. So one of the reasons people, and I'm not a plastic surgeon, my wife does some work in this area, she's also a doctor, but you make less collagen and the skin kind of, it gets wrinkles in it. So there's a technique called microneedling where there's a microneedling thing that passes around your face and it feels about like a little sunburn, doesn't really hurt, but it opens your pores and you bleed a little bit and you can put PRP in and it helps wrinkles go away. The thing that I think that is really appealing about this is that it can't make you look worse. You know, sometimes well-intentioned cosmetic procedures can give an artificial appearance, and then my wife likes to tell people it's just a matter of how does she put it, aging gracefully.
Oh, well, I like that. I do want to remind our viewers, though, if they have questions for Dr. Chadwick Podromos, our orthopedic surgeon, if you'd like to give him a call or even just talk a little bit further about any potential questions you might have or issues, you can reach him at area code 847-699-6810. Again, that number is 847-699-6810. Dr. Podromos, our time here goes by so quickly, and there is just so much more that I want to get into, and I think it's so important for our viewers to learn more about the newest technologies, what's happening out there. I mean, especially when you can have a treatment that doesn't require surgery, possibly, I would jump at that anytime.
Yes, it's, even though I'm a surgeon, it's, I was taught, again, I'm maybe kind of old school, but we're always taught that surgery should be a last resort. So I take greater pleasure in telling a patient that they don't need surgery than operating to repair them, although that's gratifying as well.
Well, doctor, we have to sign off, but I want you to come back. I want to pick up where we're leaving off and just continue this conversation. There's just so much more to cover, just in orthopedic and surgery in general. There's just so much more. I'm so excited about this. Thank you so much for coming on the show. So, thanks to the improvements and treatments in the use of PRP or platelet-rich plasma and stem cell technology to treat patients without surgery, you have a quicker recovery, and less pain. On behalf of my colleagues at Hispanocare, Advocate, Illinois Masonic Medical Center, Dr. Chadwick Bodromos, thank you so much for being on the show today and sharing such important information. I'd also like to thank Advocate Illinois Masonic Hospital for continuing to provide bilingual, bicultural care to our Latino communities in the city of Chicago. My name is Lucy Aquino, and I represent Hispanocare, a program of Advocate Illinois Masonic, and we invite you to stay tuned for more important information coming your way. Until next time, take care, and we'll see you soon. Good night.